And back now, we're Sunday House Call. Do you have chronic pain? Do you pop the pills, the Advil and Motrin and all that sort of stuff all the time? How can you effectively deal with it? Dr. Siegel, this affects a lot of people around the country. What do you do?
I want to start with the simplest thing, Eric. If somebody comes to see me and they just smashed an ankle, let's say, or they hurt a shoulder, or they fell, they say, what do I do first? Heat or cold? Everybody wants to know, heat or cold. Yeah. The answer is ice first. You know why? Ice decreases the inflammation. It decreases blood flow to the area which you want, so the swelling goes down, and then it gives it a chance of early healing. After a while, after several hours, when you're over the acute part, you said chronic pain, chronic inflammation, then the answer is heat. Because heat will relax the muscles. If you have like a stiff muscle, if you have a muscle spasm, heat will relax the muscles and it'll improve blood flow to the area, give you more and more healing. Same thing physical therapy does. It increases stretching, decreases rigidity, gets your muscles moving, decreases the amount of pain you have, and builds strength in the area. That's exercise and physical therapy. So those are the main things. Ice first, heat second, and then start to exercise and stretch out the area that you hurt.
You know, we had one stub the toe really bad. They said take a whole bunch of Advil and a glass of red wine. It worked.
Well, look, the first thing you want to do is before you start hitting the alcohol, which we'll talk a little bit now, is to do a good history and physical and find out exactly the root of the pain. Where the medicine of knee-jerk reaction of writing a prescription with Advil or some medication and get the patient out has to stop. First, you want to examine the patient, get maybe an x-ray, find out if there's a fracture or not before you start your treatment. That's number one. Number two is this is a battle between the modern medicine of prescription versus the Eastern medicine. And in this particular case, things such as low-impact exercise, swimming, yoga, acupuncture, a good physical therapist or a chiropractor, look for a good one who can really save you is extremely important. Yes, acutely you want to do the cold and warm compression, but also there are a lot of herbs you can take. For example, valerian roots, things that can reduce inflammation. Capsaicin that Arthur has talked about in the past before. Turmeric, things that will reduce your inflammation is the way to go. This is one time that the robotic surgeon is going to basically promote any kind of Eastern medicine. I like it. I think we're really doing too many of these needle spine, what do they call them?
Epidural injections.
Epidural injections. And going from medicine to acupunctures and other things, relax. First find out what the result is. If you have a fracture, you don't want to be treating it with just acupuncture.
One more thing to add. If you're going to use heat, and I agree with David's point, if the swelling persists or it turns purple, the area, you better see your doctor, maybe get an x-ray. If you're going to use heat, wet heat is better because wet heat penetrates more.
That's what my mom tells me.
It's another little trick. The old wives' tales are right.
It desensitizes the nerve endings.
Absolutely.
So you don't feel the actual pain. But I think you want also to reduce the inflammation, and that brings a lot of oxygen to the area.
That's the ice first, and then the heat
And you got a lot of these clinics now popping up, the little MD clinics. So if you can't get to your doctor, you run into.
Well, that's a good point. Stay away from the hospitals because coming to the ER for those simple pains would increase the chance of getting those superbugs.
And then they overtreat you. They give you an injection. You get an unnecessary X-ray, and you don't know what you're.
Then you can have your alcohol.
Go to Arthel's mother.
Go to Arthel's mother.
We'll talk about that.
Let's go to alcohol.